All right, it's time for another Diabetes 180 live, and we have a special guest here tonight. All right, so people, as we are doing our introductions and are talking about the subject for the night, remember to greet us or leave a message in the chat. We always like to see who's watching and where you're watching from, and greet our longtime viewers. So we have here Dr. Jeanine Swan with Silver Swan Total Wellness, specializing in functional medicine, something that I know a lot of you are interested in because we're all have the same goal. That's to basically get our body to the point where it can heal itself, right? Because we are tired of having to rely on meds, pharmaceuticals, in order to reverse chronic illness. Your body has an amazing ability once you find out the root cause of our illnesses to heal itself. So we have an amazing mind with us tonight, okay, who's been in practice for years. She's going to tell her story, and I really want you guys to sit back and listen and watch as she shares not only her story, but she's going to go through a PowerPoint presentation that talks about how to prevent diabetes and manage it naturally, okay? And of course, I know if you already have diabetes, you should still pay attention to her advice. All right. So, Miss Jeanine, thank you so much for coming on with us tonight. You're busy, clearly, right?
And let me tell you, it is such a pleasure to be here and an honor as well. And I appreciate you inviting me. I am so passionate about just spreading the word and educating people, especially us folks, especially things that are preventable or not easily addressed, but addressed. And it is my passion. I think we've all been touched by diabetes. If we don't have it ourselves, we have a loved one or know someone who's been touched with diabetes. So it's definitely a passion project of mine. So I absolutely appreciate the invitation to spend the evening with you and your audience.
Yes, our pleasure for sure. So before we go into what you're going to teach us tonight, can you tell us what what got you into the path of health and wellness? I did read your story online. It's amazing. Can you share with us, what got you started in the first place?
Yeah. Well, I will say that I've always kind of been interested in holistic holistic medicine. I growing up didn't really know a whole lot about it, so I chose the traditional route. And I did go to medical school, graduated from residency in OBGYN. I practiced for a very short amount of time and became ill. And that's kind of where my journey into functional medicine began. I went to the doctors with a lot of symptoms and presented the symptoms, and I was not diagnosed for an entire year, or actually misdiagnosed. And during that time, I had to stop practicing medicine. I was so symptomatic, and I had to stop practicing medicine. I truly believe that my story is not unique, especially as a Black woman in this country. We tend to be kind of ignored. And I'm now using the phrase gaslit. It's all in your head. And I'm sure I'm not the only person in this audience who's experienced that. I ended up having Graves' disease, and if you look up the definition of Graves' disease, Boston, I grew up in Boston, yay!
Right.
But if you look up the definition of Graves' disease, I had every single one of the symptoms, and I was misdiagnosed. And because I was misdiagnosed, it set me down a different journey in my life. And it's interesting because I was just asked yesterday if I have any regrets, and absolutely not. I believe every step in our path is an education and a learning experience and a time to be even more empowered and grow stronger. So that was my journey. I had to stop practicing medicine. I started teaching nurses. And in order to teach nurses, you need a nursing degree. So I got my nursing degree and just kind of continued on and became a nurse practitioner. And it was actually through becoming a nurse practitioner that I became more involved in functional medicine. And my passion is really just one-on-one patient-centered care, listening to people, sitting, and that the response that I get from my patients is that they're finally being heard. and their concerns are finally being addressed. And that's one of the things you can do with functional medicine, because you take the person as a whole. It is a holistic approach. And like you said, it's an approach that delves deep into finding the root cause of whatever the illness or their health concern is, and addressing them as a whole rather than putting a Band-Aid on the situation. So I love what I do. I'm very passionate about it. And I just love seeing people improve and being able to join them on their journey to wellness. So.
Yes, yes. Thank you so much. And you have that's such a relatable experience, just I don't know how many of you guys are watching that can relate, but that's something that I've experienced a lot in this medical practice, where especially people of minority, people of color, people who are minorities, to really just kind of be set on the side and not given the time and attention that they need to find the proper diagnosis, because that's where it starts, right? Being properly diagnosed. But yeah, we're gonna hear a lot about prevention and management. Even though our channel we talk about reversal for those who have diabetes, but again, I want to highlight, even if you have diabetes, I'm sure, Jeanine, you're going to talk about the fact that these lifestyle changes can help everybody on the spectrum of diabetes. But so please keep watching. At the end, we're going to give you an opportunity for free lab work. Who doesn't like free?
So not lab work, lab review.
Lab review. Sorry, yeah. That's what to say. Lab review. And I trust me, like as I'm a PA, you're a nurse practitioner. How many of us, our friends, family, coworkers come up to us like, hey, can you look at these labs, right?
Oh, 100% all the time.
This is somebody who specializes in those labs and interpreting them, who's going to interpret them for you. So make sure you watch to the end for that opportunity to get a free review and interpretation of your lab work. All right, so I'm excited for that. I'm sure you should be. So would you like to jump on to the PowerPoints?
Sure, absolutely.
After that, yeah.
All righty. So this is me, just an introduction, and you've heard a little bit about my story and how I got into it. And if you learn more about me, you'll learn more. But we can continue on. So diabetes and prevention and management. So first of all, what is diabetes? We hear, most of us are familiar with the term, but many of us, and I find this to be very true in practice, don't really understand what it is or how the medications work and why they need the medications. So it is a disorder that interferes with the body's ability to use sugar. And in the body, every single cell uses sugar as energy. And so if the cells can't use sugar, they have to find another source of energy. And I'm going to use sugar and glucose interchangeably throughout this talk. And glucose is the main thing that we talk about, but sugar is kind of like the layman term. And so it's kind of like your car. You have to put gas in the tank for the car to run. If you don't have gas in the tank, the car doesn't run. And it's the same thing with our cells in our body. If we don't have sugar or glucose, the cells aren't going to function properly. And so for the cells to be able to receive the glucose, it's like a lock and key mechanism, where there's a door, and then there's a hormone in the body called insulin, which I'm sure many of you have also heard that term before. Insulin is the key that unlocks the door that allows the glucose or insulin or sugar to enter the cells. And so you need insulin in the body to properly be able to get the glucose into the cells to be used. And so if you don't have enough insulin, or if your cells aren't happy with the insulin, we'll say it like that for now. If there's insulin resistance, your body's not going to be able to use glucose the way it should. It's going to build up in your blood. That's going to lead to increased blood glucose, hyperglycemia, that can be very damaging to all the cells of the body. Next slide.
Yep.
All right, so there are many different types of diabetes, and once again, most of you have heard of a few of them. I didn't mention all of them here, actually, but there's type 1, there's type 2, and there's gestational. Those are the ones I'm going to mention. Type 1 diabetes, we often think of that as juvenile, quote unquote, diabetes. You see it more often in young people. And this is when the pancreas, which is an organ in the body that produces the insulin, that key that unlocks the door, just basically completely poops out and stops producing insulin altogether. And because the body has an absolute requirement for insulin, it needs insulin. These people who have type 1 diabetes are going to have to be on insulin for the rest of their lives in order to properly be able to use glucose. Gestational diabetes just occurs in pregnancy. And so any of our audience members who've had a child know that they've had to take that sugar test. It's horrible. It's like syrup. And if your levels are elevated, you're diagnosed with gestational diabetes. It resolves after you have the baby. The interesting thing about this is they say about 50% of women who have gestational diabetes will go on to develop type 2 diabetes 5 to 10 years later. And so this is a clue for some of you all that maybe you're at increased risk and you can do things to ward off and decrease the risk of developing diabetes. And then, of course, there's type 2 diabetes. This is going to be our discussion tonight. 90% of diabetics or people with diabetes in America have type 2 diabetes. And with type 2 diabetes, what's happening is there's an increase of glucose in the body. The pancreas is trying to keep up with all the glucose and deal with it. And the pancreas does start to poop out. That's my word I'm using tonight, apparently. And so the pancreas is producing less insulin, but also the cells are less receptive to the insulin. And so that you develop insulin resistance. And we can talk about that a little bit more as well. What I've written here is that type 2 diabetes is absolutely preventable in most people, and remission is possible. And we talk about reversal, and I use the term remission and what I mean by that is if you're diagnosed with type 2 diabetes, there is a possibility that you can come off the medicine. I don't know if I wrote that here or in another slide.
You did. Remission is possible. Yep.
Okay, I have it in. Thank you.
I'm reading.
Okay, thank you. All righty. So the only other thing I want to mention in this slide is that traditionally type 1 diabetes is in children, and type 2 diabetes you see in older people and not just older people, but obese adults. We're seeing an increasing population of young people, even preteens with diabetes. I saw someone recently, 11 years old, with type 2 diabetes. And so I put the question there, why? And I know I don't have much of an audience right now, but I want you to think about why that is. And I bet you can come up with the answer.
Yeah.
So the answer is that obesity is really a problem in this country, right? It's actually considered we're thinking of it as a chronic disease. And so that's leading to children, more and more children developing type 2 diabetes. All righty. So diabetes type 2. And this is, I'm smiling because I use this phrase all the time. We live in the land of good and plenty.
It's true.
We really do. We love our fast food. We love our McDonald's. We overeat. We eat much more. We take in much more calories than our bodies need or are going to use. And if we're taking in more calories than our bodies need and are going to use, how do you think that those extra calories get stored? They get stored as fat, right? And so now we have obesity and overweight happening. So, and that's what I say. So many Americans eat more than they require. This excess, these excess calories and just excess in eating does cause the pancreas to eventually, once again, poop out, and it's going to stop producing as much insulin as is needed for the body. It actually can get to the point if someone is chronically hyperglycemic, meaning chronically having elevated blood glucose levels, the insulin, the pancreas may poop out altogether, and then they're going to end up requiring insulin. So even for type 2 people with type 2 diabetes who start off on medications, some of them may eventually end up having to take insulin if they don't manage their diabetes properly. And I talked a little bit more about desensitizing. The cells become desensitized to insulin. And what that means, once again, is we're living in the land of good and plenty. We're taking in much more glucose than we need. And the cells are like, you know what? I don't need all that glucose. So they change the locks. I don't need all those family members coming in to see me on Thanksgiving. They change the lock. So your cells change the lock. The key The insulin, which is the key, no longer fits that lock and no longer opens up the door. If the door doesn't open, glucose doesn't get into the cell, it builds up in the blood, and now we've got excess blood sugar running around in our blood.
Yep, yep.
In our body. So, all right, what else? Sugar. Okay, good. Next slide.
Yep.
All righty. So, diabetes, again, we're still in type 2. Some of the things that can cause it or increase the risk, being overweight and obese do increase your risk. Many, in fact, the majority of Americans are at least overweight or obese. Genetics also does play a part. So if you look around at your family members and you have brothers and sisters or fathers and mothers and other family members that have diabetes, you are at increased risk for developing type 2 as well. And then certain ethnicities, and African American is one of the ethnicities that are at increased risk. The Latino population as well. What's interesting is there's a population of indigenous people, Native American, who almost 100% of the population has type 2 diabetes. So there definitely is a genetic component to it. Now, for diabetes, there usually are no symptoms. And so many Americans are walking around with diabetes or type 2 diabetes and aren't aware of it. In fact, if you have symptoms, it's usually because your blood glucose level is really high. So the majority don't know they have it. Risk factors for diabetes, we've already discussed being overweight, and that is actually a category we'll get into, or obese. Family history, physical inactivity. And honestly, physical activity goes along with obesity, but physical activity in itself physical activity helps us to use the excess sugar in our body. And so if we're inactive, it's not getting used. So it's being stored as fat. And age over 45. So all of my folks over 45, y'all are at increased risk as well for developing type 2 diabetes. So as I said, most people don't realize they have it and aren't symptomatic, but some of the symptoms of high blood glucose level.
Yeah.
I talk really fast. I am so sorry. Please slow me down. Please slow me down. I feel like I have so much I want to say. But some symptoms are increased intense thirst. So if you find yourself drinking water all the time and peeing a lot, that is a sign that your sugar levels might be elevated in your blood. Blurred vision and fatigue are some other signs.
Those are huge. Yeah.
All right. Alrighty, so complications of long-term diabetes. So just chronic elevated sugar in your blood. Sugar in your blood is actually very damaging. It's damaging to all organs. It actually is damaging to blood vessels. And so your blood vessels get damaged. And imagine your blood vessels basically feed all the organs in your body. Also damaging to nerves. So complications, we have heart attacks, strokes, kidney disease and kidney failure, vision problems and blindness, decreased ability to heal and fight off infection, loss of sensation or pain or numbness and tingling in your extremities, like feet or hands, and that's called peripheral neuropathy. It's due to nerve damage, amputations, ED. And when I say ED, a lot of the men in the audience perk up because they were like, what? I didn't know that. But I'm referring to the men. So as I say in this slide, 75% of people who have diabetes, they don't die of diabetes. They die from heart attacks and strokes. Yeah. When you think of people who are on hemodialysis, the majority of them have either diabetes or high blood pressure. Many of them have both. And then the majority of amputations in adults that are not non-traumatic, meaning it's not because they were in a car accident or something, is due to chronically elevated glucose levels, diabetes. Yeah. And so these are some of the complications that we have to think about that happen when our blood glucose levels are chronically elevated. Yeah. All righty, next. So some statistics for you, because I can't have a talk of diabetes without statistics. And these statistics are up to date. I got them from the CDC, and they're for Americans. So they're for our audience. Well, I don't know where the audience is, but they're for Americans. But we have, so 1 in every 10 American adult has diabetes. Out of the people who have diabetes, 1 in 5 of them don't even know that they have it. So that's a significant, in our audience right now, that might be someone in our audience right now. Pre-diabetes, and we'll talk about a little bit about the levels and what makes you pre-diabetic. But 1 in every 3 American adults is pre-diabetic or has pre-diabetes. 1 in every 3. So you could look around in your family right now. Somebody has pre-diabetes, and out of the people with pre-diabetes, 8 out of 10 of them don't know they have it. And so that's, once again, a really scary thing. And what we're going to learn is that prediabetes is absolutely reversible, and diabetes is preventable. So it's really all about educating and identifying this before it becomes an issue.
Sure. Yep. Yeah. Absolutely agree.
Alrighty, so preventing or delaying type 2 diabetes. And I say delaying because, as I said, there is a certain number of people who are just genetically predisposed. I talked to you about the Pima Indians, who 100% of the population has diabetes. But for our population, it's largely preventable. So as I said there, knowledge is power. Hi, Carly, I'm seeing you. We're going to work on you, girl. We're going to work on you.
Yeah. And also acknowledge too, Sophia and Carrie Ann, thank you for watching. Yep. And,
yes. Stress eating. Yes. I feel you. All of that. Absolutely. And so that's why this message is so empowering, because we know we have ways that we can actually prevent or at least delay and slow down. So as I said, their knowledge is power. I truly believe that. And I know you believe that too, Lewis. If you know you are at increased risk, you can take steps to prevent it. We have something called modifiable risk factors. Modifiable risk factors means risk factors that you can do something about. You can't do anything about your age. You can't do anything about your genetics. You're born with what you're born with, but you can do something about your weight. You can do something about your level of physical activity, about your food choices, and about the amount of food that you can consume. You can do something about stress. I know as I stress eat, I know all about that. I will gain 10 pounds and lose it, and there you go. It is important to know your BMI. BMI is wow. Help me out.
Yeah, basal metabolic rate. Yeah.
Went in and out of my head that fast. That's menopausal brain, girls. I'm telling you, it's a real thing. Basic metabolic index.
Right. Yeah.
Basically what it does is it takes your height and your weight and it gives you a number. That number is very important to know, because that is what's going to determine if you are within a normal weight, if you are overweight, or if you are obese, or if you are morbidly obese. So I included a link there. Actually, maybe you can put that link. I don't know if you're able to.
I won't be able to catch it because it's written on the PowerPoint.
Okay. No worries. You can actually Google BMI, but I want all of you all to, if you have a moment, Google and find out what your BMI is, because once again, knowledge is power, and that's going to help you to determine where you are on the spectrum of weight and what you need to do about it.
And I'm sorry, I wasn't hearing you right. I thought you were saying BMR for some reason.
No, BMI, yeah, index. It's basic metabolic index, right?
Index, yeah.
I'm having a real brain fart on that. Oh my goodness. But anyway, okay. So I challenge each and every one of you to discover what your BMI is. It's a really simple thing to do. And once again, you have that knowledge, you know how you need to address it.
Yep.
Let's see. Oh, and then I just mentioned that physical activity, it can reduce your weight, but it also reduces your blood glucose level, because as your muscles are working, they're using up glucose. So activity is twofold. It helps with weight, and it helps with reducing the risk of developing prediabetes and diabetes. And then I mentioned even just walking, even if you can get up and just walk for 30 minutes a day, maybe 30 minutes, baby steps, 30 minutes every other day. I started swimming because my joints don't like doing anything else, and I love it. But just I challenge you to, for your own, I heard someone say the other day, and I was like, that is so true. Life is hard enough. Why make it any harder? Yeah. Exercising we talk about that in a later slide, but just make it a habit. And then of course, if you are smoking, you have to stop.
Mhm.
100%. You have to stop smoking.
That's huge.
All righty.
So, and as we're changing slides here, I want to talk really quick. What you said about the Pima Indians is so interesting when you talk about genetics and lifestyle.
Yeah.
When you look at the Pima Indians living across the border in Mexico, they don't have the rates of diabetes that the Pima Indians with the same genetics have
Really?
in America. Yeah. So it's interesting. It's a great genetic study because the Pima Indians with the same genetics, right? Same
Yeah.
family history or genetic generation. When you cross the border, you have a different lifestyle. They're eating
Yeah.
more plant-based, they're eating healthier, they're probably more active, right?
Yeah.
Diabetes is like non-existent. With the same genes, you take
Yeah.
that to America.
Yeah.
Yeah, so
Land of good and plenty.
yeah,
Doesn't mean that's not a good thing.
good and plenty. So no matter what your genes are, people, the hope is your lifestyle doesn't have to pull the trigger.
Yes. Oh, I love that. That's a great message.
Yep.
All righty. So goals of treatment. If you have diabetes or even pre-diabetes, is first of all, it's important to coordinate with your healthcare provider. We're talking right now, and we can give you great advice what to do, but the first step is identification, and that's going to be through your primary care provider. So I don't want this talk to discourage you from seeking healthcare, because that's a very important thing, and it's a team effort, and that team involves you and your healthcare provider or whoever else is helping to manage your healthcare, like me, like you. All right, so it's a chronic condition that requires regular monitoring of your blood glucose level. This is, once again, is very important. If you are diabetic, I know so many diabetics who don't monitor their blood glucose levels, and they come to see me and they're shocked that their levels are so high. What? Really? I mean, you get knowledge is power. So and if you're able to keep your blood glucose level in a normal range, you can prevent or at least prolong the course of getting complications. Did I say that? You know what I mean. Yeah. Okay. Yeah. So the complications from diabetes have everything to do with having high blood glucose levels. So you keep your blood glucose levels down, you can prevent the complications. And that's what I say. Their complications will absolutely occur if you're neglecting yourself. Once again, I've been in healthcare. We didn't mention this, but I've been in healthcare for over 30 years. I've seen people in their 20s with amputations because they just did not take care of themselves. So self-care, very important. And part of self-care is making sure that you're regularly monitoring your blood glucose level if you have diabetes. Also regular foot care and eye exams. Seeing specialists if you're referred to them, cardiologists and nephrologists, those your heart doctor and kidney doctors, very important. Yeah, and then I've mentioned once before that type 2 diabetes is usually controlled with medication, but for some people they do end up requiring insulin. And by then it's not really reversible. We talk about reversible, but if you've gotten to that point, you're going to need insulin. So the hope is to identify people early and prevent that need. All righty. So diabetes remission. Yeah. So pre-diabetes, absolutely reversible. I am a living testimony to that. Just quickly, I'm not going to have a whole lot of time, but I will say I was pre-diabetic for years, but my doctor never bothered to tell me. I discovered it myself when I switched doctors and happened to look at my labs. And so I worked very diligently to try to maintain my hemoglobin A1C, which is what we'll talk about. I'm sure some of you are familiar with that, below the pre-diabetic range. And that's important because you can prevent diabetes. Once you've entered that diabetic territory, though, it is definitely much more harder to prevent or revert. I mean, not prevent, but reverse. If you're within the first 6 years or not taking insulin, it's easier to reverse and to go into remission. And I know people, my mother is one who's no longer taking diabetic medication. So it can be done. All righty. So this is I wanted to add some little pictures. So functional medicine. So now we're kind of getting more into the functional medicine aspect of it. And once again, it's a more holistic approach. And so you and I were having this conversation before everyone joined us about eating and eating healthy. I mean, and we've talked about diet, and you were talking about the PM. I mean, it's amazing. It's absolutely amazing that when what you see, for instance, French people have a very rich diet, but they're a lot healthier than us. They don't have the heart disease, they don't have diabetes, they don't have those issues. Asians that are actually live there, not in this country, but live in Asia, who eat a lot of rice and other products, and they don't have the diabetes that the Asians and that we have here.
Yeah.
But anyway, so eating a rainbow. I
Yeah.
say this all the time. People don't get what I mean, but that's why I put those pictures there. I don't know how well you can see them.
Oh,
But
we can see it. It's clear. Yeah.
yeah,
I mean, it's
eat it
small, but you could tell,
small. Yeah.
it's
So
it's colorful.
you gotta eat a rainbow. When you go to the grocery store, you gotta pick up different colored vegetables and fruits. Don't be scared. Don't be scared.
Don't be scared.
And then I have the food pyramid. I'm not sure if you all are familiar with the food pyramid. It's kind of replaced, we used to think of 4 squares, and also My Plate that kind of shows the portions of food that you have. The food pyramid, and once again, I challenge you all to look up this resource, or just Google food pyramid, because you're going to be surprised how much food our pyramids are upside down. They just truly are. And if you haven't seen the food pyramid, you don't know what I mean. But once again, I challenge you to go look at the food pyramid, and understand, you'll understand what I mean by we're eating upside down. We're eating much more of foods that we don't need. So we were talking about meats and things like that. We don't need that much meat to be healthy.
Yeah.
All righty. There it is. I forgot I put that picture in there. I put that picture in there. So you can see foods and desserts and things. They're at the very top of that pyramid. That's because you only need a very small portion. And then the foods at the bottom, these are the foods that we need to concentrate on. I've seen some food pyramids that actually add exercise and activity in there, and I love that. So once again, I challenge you to look at the food pyramid and try to make adjustments to your eating habits.
Absolutely.
All righty. So things that we know but need to put into practice. And once again, I'm sure this is the majority of you all, because I know it's me. It's something I need to work on. So what do we need to do? Increase fruits and vegetables in our diet, right? Even if they're frozen. I started making smoothies, and you have to be careful with that, because you don't want to get too much sugars and processed things. But increase fruits and vegetables in the diet. Choose low-fat dairy products if you're going to have dairy products, and foods that are low in saturated fats. Saturated fats come from animals. Yes, lean protein. Yes. So saturated fats come from animal fat. So, and that's why we probably, as Americans, we eat too much of that saturated fat, and it causes issues with cholesterol, issues with high blood pressure, diabetes, heart attacks, and strokes. And that we want to monitor the amount of food we're eating. Of course, sweets, simple carbs. We eat a lot of processed foods, and those processed foods and refined grains. So just foods it's kind of like junk in, junk out. We want to avoid sweetened drinks, sodas, and juice. Water with electrolytes in it. Those are good things to make sure you're consuming. We talked about getting active, even if it's just a short, brief walk daily. I challenge you to increase your activity level. Stop smoking. That just is a no-brainer. You will hear time and time again that losing just 5 to 10% of your body weight has a huge impact in your health, and actually can help prevent or delay diabetes and high blood pressure and all those other things that come as we start to age. And so once again, I challenge you to look at your weight, calculate what 5 to 10% is, and we're going to talk about ways to how you can decrease that. And as I wrote there, it can have a significant impact on high blood pressure and diabetes. I've seen people, and actually I'm going to go back to my mother, who she always complained about the number of medications she was on, and we kind of worked on her and adjusted it, and her blood pressure is better, diabetes is better. When you adjust what you're eating and adjust your weight and your activity level, you'll be amazed at how healthy you can become.
Yep.
And then once again, living in the land of good and plenty, as I said before, we consume much more calories than we need to. So if we can calculate how many calories we need, and just make sure that's what we're consuming, And then reading food labels. A lot of times, and I think this is in another slide as well, and I'm guilty of this as myself. I'll read something and it'll say serving size 2, and I just ate that whole thing to myself. So you got to double up the amount of calories that you just consumed, because yeah. So make sure you're reading labels for a variety of reasons.
Yeah, and then just real quick on the idea of good and plenty, I've been spending time in Portugal. It's interesting in Europe, one thing you notice when you're in Europe and European countries, there's not as much obesity as you see in the States. And you go in a store, there's a lot of reasons, but you go in a store, you see the portion sizes of things like snacks. You go to Walmart or Food Line and you get these family size bag of chips, but even the normal size bag of chips are like big, twice or a quarter bigger than the ones here in Europe. Our what we call normal snack sizes are not normal.
No. And we're eating the whole, well, I won't speak for other people. I'm eating the whole bag. It's a problem. It's a problem.
You give it to me, it's going to be gone. Just period. Yeah.
All righty. So calorie goals. Yes. Bioengineering. Yep. And then you've got hormones, you've got antibiotics, you've got things that cause problems with our endocrine. That's a whole other topic. If you want to talk with me, you're absolutely welcome to. But so yeah, daily calorie requirements. I'm going to let you read those because I am keeping track of the time. But what I want you to look at is which category you're in, so that you can calculate your daily caloric requirement, how many calories you need in a day. And then once again, I challenge you to kind of keep an eye on what you require and how much you're actually consuming. And I know I drink coffee like it's dessert. And if any of you all have a habit like I do, you're probably taking in 500 to 1,000 calories just in a coffee drink. That's like two meals. So we really need to be a little bit more cognizant of how much if you're taking in excess calories, guess where they're going, guys? They get stored as fat. Those calories that you don't use get stored as fat for later use as sugar, basically, or for not later use, just fat. So we have to be careful with how much calories we're actually consuming. All righty.
And as you go to the next slide, I'm so sorry. This is definitely not regular. I need to charge my laptop because I want to make sure this whole show doesn't cut off.
Okay. Well, you go ahead on and do that. I want to talk about this.
I won't be safe. So keep talking. I'll be right back.
Oh my gosh. Okay. I love that. Hi, guys. All righty. So tips and tricks again. So to losing a target of 1 to 2 pounds a week is healthy. You really don't want to lose more than that. And you will have a rebound weight gain as well. I challenged myself last year. I turned 55 last year, and I challenged myself to lose 25 pounds, and I was able to do it. And it was by using this method. So this is, there's several different things you can do, but really watching your consumption of calories and increasing your level of activity. And so what you need to do is calculate how many calories you're supposed to be consuming to maintain your ideal body weight, and then subtract 500 to 1,000 calories per day. And if you do that every day and increase your activity level, that will help you decrease the weight. Once again, for me, like I said, I just laid off coffee, which is hard for me. But that really helped me to lose the weight. I was drinking my calories. The other thing is in order to do this, you really need to be monitoring your weight. And I know they say not to check your weight every day, but if you're really targeting weight loss, you want to know your daily fluctuations. If you've gained a pound, then maybe the next day you need to not have that coffee drink and you need to walk an extra half hour. So once again, knowledge is power. If you know what your weight is and you know what your goal is, then you're going to be able to work toward it when you have that information.
Absolutely.
All right. He's back.
Yeah, I'm back.
All righty. So ABCs of diabetes, and these things are all important. Once again, chronically elevated blood sugar levels just damages everything in the body. And as I said before, people with diabetes die of heart attacks and strokes. So the first thing is knowing your A1C, and I made it A, but I'm used to saying hemoglobin A1C. And the hemoglobin A1C, for those of you who aren't aware, is a way to measure how well your sugar level is being maintained over the course of a few months. And so you can check your sugar every day, and maybe your sugar looks fine every day, or maybe it looks high every day, and you have highs and lows and all over the place. That's giving you moment information, like immediate information. But to get an idea of how well you are maintaining over the course of months, you really need to look at the hemoglobin A1C.
Mhm.
This is also one of the values that's used to determine if you are pre-diabetic or diabetic. The B is blood pressure, and once again, there's a close association. Blood pressure also increases the risk of heart attack, stroke, and kidney disease. And as we said already, those things you see with people, and they often have, when people come to see me, they often have diabetes and high blood pressure. And so we're there, you can do similar things to help maintain both of them. Cholesterol we haven't talked much about, but also cholesterol increases the risk of heart attack and strokes. And cholesterol can be lowered by, once again, monitoring your diet and eating the recommended diet. And also exercise can help with that as well.
That's huge. Yeah.
Mhm. Alrighty. Targets for preventing complications. I'm not going to read them. They're right there. Maybe take a screenshot. These are for people who actually have the disease. So if you don't have diabetes or pre-diabetes, you don't want your hemoglobin A1C at 7. You want it to stay below like 5.6. But if you actually have diabetes or high blood pressure, these are the levels that you want to target to keep it below.
Oh, yeah.
All right. So once again, treating any healthcare issue, especially if it's a chronic healthcare issue, should be a team approach. And so the PCP, that's your primary care provider. Me, I'm the functional medicine provider. I work very closely, like I said, with patients individually or clients individually to get them where they want to be. But it is still important to maintain a relationship with your primary care provider. For people who actually have diabetes, they absolutely should be seeing a nutritionist or a health coach to help them discern what it is that they need, and how the calories they need to consume, the other things that we'll talk a little bit about. People with diabetes should be seeing a podiatrist regularly. They should be getting regular eye exams. And like I said, maybe seeing the kidney doctor and other things. What do I have here? Infections. Yeah. So once again, it's important just to monitor yourself. If you have diabetes, you're looking at your feet regularly to make sure that you're not having an infection there. And that's because diabetes can cause what's called peripheral neuropathy. It's damage to the nerves. And so you may know people who have diabetes who get this kind of tingling sensation in their feet, or pain in their feet, or have decreased sensation in their feet. And it's because their sugars are chronically elevated and it causes damage to the nerves. And so if you don't have sensation in your feet and you're walking around cutting up your feet or walking on a pebble, or you have a burn and don't know it, you can have an infection and not know it. And so that's why it's important to monitor those things. All right. Oh gosh, that was supposed to be deleted. We'll ignore that one. So, functional medicine nutritionist. So functional medicine, kind of as a practitioner of functional medicine, I combine, and I think my approach is maybe different than others because I have the medical background as an MD. I have my nurse practitioner background, and I'm also certified as a functional medicine practitioner. And so I can combine nutrition with that. And so once again, that's very important. Once again, for all of you all who this is something that you're either experiencing or maybe at increased risk, seeing a nutritionist can be helpful because they can help you to determine how many carbohydrates you need in a day, how to read packaging, fiber. And so we haven't really talked about fiber too much, but fiber is not readily, it's not absorbed by the body. And so when you consume it, it kind of goes straight through. But what it does is it slows down the body's absorption of sugar and decreases the body absorption of sugar from carbs. And so that can actually help if you increase fiber in your diet, it can actually help decrease your blood glucose level. And then meal timing is very important, being consistent to avoid spikes and lows, crashing and all of that stuff, and giving your body a chance to digest. I'm a grazer. I eat all the time, which probably isn't a wise thing to do. But.
A lot of us are. Yeah.
So lifestyle, how much time do we have left?
We usually run to about 45 minutes. We're probably close to the end.
Yeah.
But so I want to make sure we do have time to plug in
Mhm.
your website and your
Yeah.
offer. So just, you know, you
Yeah.
could summarize what you need. Yeah.
Yeah. So these slides are pretty self-explanatory. So hopefully you all will have access to them. Just some lifestyle recommendations, some diet recommendations, some supplements, things like that. But I will go, if we can just go to the last couple of slides.
Yeah.
Yeah.
And this is what we had for me. Yeah.
Oh, is that it?
Yeah.
Can you do like the slide before?
Let me see. On your website.
No, 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 not the website, the actual PowerPoint.
Oh, the PowerPoint. Yeah, I'm sorry. Let me go
Yeah,
back. Yes, sorry.
it's okay.
Yeah.
Go to, if you can go to like the last,
Let me go back to. Is it which one?
maybe like the last slide or the last two slides. I think it may be
Yeah,
the very last slide.
that's probably it. Or is it?
So this is it. This I wanted to offer you guys, actually, just go back one more for me.
Sure.
Yeah, so I wanted to offer you all a free lab review. This is $100 to $100 value that I want to be able to offer you. If you have recent labs, I'm going to let you submit them to me, and then you can schedule a consult with me, and I will go over your labs and give you some ideas about where you are and where you need to be, and I can help get you there.
It'll
And
be in
then
the
you can.
chat. It'll be in the chat too. So you guys
Yay!
go in the chat and click on the link, right? Wherever
Yeah,
you're watching from, just you click on that link and you'll get
yeah.
you hooked up. Yeah.
And then that very last slide gives my contact information as well. I'm sorry we didn't really, it seems like we really didn't get into the actual holistic portion of it.
We're gonna have you back on. Don't worry, you're gonna get to finish.
I
Because
love this. Bring
this
me
is
back.
really good. I mean, like
Yeah,
a lot of us miss the basics, right?
yeah,
And I get a lot. I mean, everything you mentioned, I've gotten questions on a million times over, or
yeah,
misunderstanding when it comes to what's normal,
yeah,
how to prevent diabetes. So it's really good, and I'm sure our viewers want you back, right, guys? Let us know. Talk to us. We want the rest. There's quite a few
wow.
more information to
I'm looking at David's now. Yeah. I'm sorry. Go ahead.
yeah. So this is something that I think, you know, we need to revisit. And so those of us who want to continue, you know, with Miss Swan and her work with preventing diabetes and managing it functionally, right, with functional
Yes.
medicine, a
Yes.
great way to connect with you is through this link that she shared through her website, as shown right here, and also here. If I could scroll to the top. We do have a fancy QR code right here in the corner too. If you want to scan, that'll take you right to your lab review, right?
Yeah.
But yes, Miss Swan, any final words or any closing words you would give
Yeah.
our audience? You know, yeah.
I, like I said, I know that we've all been touched by this, and I'm just smiling because I've been able to work with people who were concerned about the amount of medication they were taking and had diabetes or newly diagnosed diabetes and high blood pressure. And I was able to actually coach them and get them off their medications. And I do use supplements and oh, you know what? Can you go to the functional medicine wheel? I think it's the second to last slide, if we can get there, because I want to show that this right here, functional medicine really is a holistic approach. And so what we deal with as functional medicine practitioners is every single thing on this wheel. And so we didn't get to really talk about cortisol, but stress, cortisol levels, sleep, exercise. Oh, there's so much more I wanted to talk about. This is going to have to be a two night discussion.
Night discussion.
We got into the basics.
Coming, y'all. Right. Sophia says more. Please come back.
Yeah.
We hear
Yes.
you. All right. So thank you so much, people, for watching, our viewers. Miss Swan, thank you so much for being with us and giving us your time and expertise. But we're gonna definitely have you back. Beloved, I pray above all things that you may prosper and be in good health,
Amen.
even as your soul prospers. We'll see you next week, Monday, same time.